Hi everyone, welcome to your Ergonomics and Chair Positioning Part 2. I had the first video, it helped a lot of people, everybody was like it's an amazing video and it really helped us, so I thought I'll do a Part 2 of this as well. Bit of a revision, a bit of understanding chair positioning, ergonomics. At the same time, when we're doing front tooth, which chair positioning works for you, when we do a back tooth, which chair position works for you, and so on. If you have not seen the part 1 of my ergonomics video, please go and watch it first. I had 3 parts to it. I posted the first part on my YouTube as well. For people who are doing my full comprehensive course could see all the 3 parts of it. But this is a part 2 version. So see that first so you get a bit more detailed concept and idea of it. In today's video, we will cover a few of those points again. Okay? So first thing we need to understand with ergonomics, what is the way it was designed, the reason it was designed, and the reason why it was doing is to prevent injuries for clinicians. Back injuries, neck problems, shoulder problems, and all that. So what we need to do, with a long story short, is we need to make sure when we're doing with a patient, we're not bending too much, okay? We're not raising the shoulder too much. At the same time, our arms are not too far away. Has to be close, so tucked in to the body. Now, the way we do it is we need to make sure whenever we're doing with a patient, the elbow is at where the patient head is or where the working area is. For example, if I'm seeing the elbow, it might be great for an upper teeth, but maybe for the lower teeth, it's not that great or it's far away. That's the time the chair is basically telling you that, change the position. Let me quickly show you a couple of teeth and give you a bit of an idea. Now, if I'm if I'm working on the top teeth, which is your front 6 and teeth, which are my favorite tooth to work on, ideally the patient has to be in the supine position, okay? Okay, and then you are sitting at 12 o'clock. If you notice, my elbow is around at the same position, okay? And then this is the motion when I'm working on, when I'm wearing my loops and everything, I don't have to bend too much. I can literally see what I'm doing. Now, if I am a right-handed position, and we've discussed it in the last video, I can go from 1 o'clock all the way to 7 o'clock. This is the position I want to do that. Vice versa, if someone is a left-handed, they can sit from 11 o'clock all the way to 5 o'clock. That's how they will work, okay? Now, central incisors, if I'm working, all good. As soon as I start going to the canines, what I need to do is start coming slowly to 1 o'clock position at the same time. 11 o'clock position at the same time. The patient head is going to tilt on the other side. So I can carefully start working on what I'm doing. Same time, if I'm going on the second quadrant, then the patient head ideally has to be tilted on this side. So then I can come up to 1 o'clock and I can see where I'm going. Now, one concept is your chair cannot move from 1 o'clock position. Your chair has to stay at 1 o'clock. However, your body can slightly move and see the back molar, but your chair cannot go anywhere from 1 o'clock. That's important. Secondly, same thing, your palatal or the lingual, in upper teeth, this is palatal. Indirect vision you'll be doing. Anytime you're not using indirect vision, you're not respecting the ergonomics and you'll be bending. So practice indirect vision. That's mostly for upper tooth. The second way of the lower tooth is generally 45 degrees, so it should be parallel to the floor. And what we need to do is just bring this down. Generally, if someone's working on a molar, which is the most common tooth we work on, then generally you're sitting at say about 9 o'clock or slightly 10 o'clock or somewhere in the middle there, generally 9 for me. And then this is where you're working on. You can see exactly what you're doing. Now, if someone says, I want to do a crown prep on 4-6, tell me. Then what I would do is I will start from 9 o'clock. All the occlusal reduction can be done from 9 o'clock here. my buckle reduction and some of the interproximal can be done here as well. But the tricky bit comes when people say, I can't do lingual. Can you tell me how to do distolingual or lingual or 4-6? Then what you need to do is bend the chair back a bit, slightly, not too much supine, slightly, say it's 45, just increase the angle a bit more and turn it towards you. As soon as the head is tilted towards you, that's the time I could see. If I come back at 11 o'clock, I could exactly see from this view where I can actually work on. So if I show you from my angle, this is the view that we are working on. And if you notice, you could literally see all of the lingual there. Okay. Now, vice versa, if I want to do the lingual in another way, then you come back and you sit at 7 o'clock here. Okay, right in front. The paddle is in the way. Right in front here. And then ask the patient to tilt it towards you. This is the time from 7 o'clock. I can literally see all the lingual and I can work on all the lingual there. This way. And if you tilt, you could see from this angle, you can see all the lingual. Now, if someone is a left-handed operator, and someone asked me this question recently, if I'm a left-handed operator, and it's difficult because I've never worked left hand, but if I'm a left-handed operator, I want to do 3-6 and I can't do the lingual, just do the same situation for your hand, right? 3-6 is 4-6 for you because it's a lot easier. You could see it. So the same thing you do is basically you are retracting from, because that's your dominant hand. You can do everything buckle while sitting at 9 o'clock, not 9 o'clock, 3 o'clock for you now. And then occlusal, interproximal, and for doing the lingual, what you can do is either you can come at 1 o'clock, tilt the patient heads towards you a bit, and then what we need to do is you can see it from here. Or you can come at 5 o'clock position here, and then this will be the way you can do all your lingual. Hope that's helpful. If you've not seen the first video, go and watch the first part. It tells you a detailed idea of ergonomics and chair positioning, but this was just a recap for certain people. If you have any questions regarding the ADC exams, or if there's any particular video that you need help with, send us a detailed comment with the detailed brief of the question or the video you need, and we'll be more than happy to provide more information for everyone. Okay, God bless everyone. Let's see you all in another video.